Namaskar, everyone. A warm welcome to our program, Specialized Yoga Teacher Training Certificate course, Prenatal and Postnatal Yoga. It's a 60 hours online course where 35 hours are self-study and 25 hours are live Zoom session. This program is starting from 11th April 2026. This is the batch 2. And in this program, there are 4 modules. The first module is Physiology and Psychology of Antenatal and Postnatal Women with Yogic and medical perspectives. Then our module 2 is Prenatal Yoga Asana. Our module 3 is Ayurveda for Pregnancy and Postpartum Wellness. And fourth module is Pranayam, Chanting and Meditation in Pregnancy and Postpartum. So friends, while having discussion with a lot of yoga therapists, young students who want to join this program, the first question that appears is, why is hellomyyoga prenatal and postnatal yoga teacher training course is over 6 months? Being it's a 60 hours program, why over 6 months? So friends, first of all, pregnancy is not a crash course. It's not a weekend topic. The problem with the fast track certification is, like most of the programs are between 7 to 30 days. After primary research of different available prenatal postnatal programs, we realized that most of the programs are between 7 days to 30 days. And we realize in this period, you can understand about the concept. You can share asana sequence. The teacher can provide surface level anatomy. But what about clinical understanding? You are going there as a yoga therapist. The pregnant woman will be banking upon you for everything. How do you plan to integrate Ayurveda, yoga, and Western physiology? How do you develop that teaching confidence? How do you plan to address real case complexities? We realized in our primary research that 70% of yoga therapists, after completing their prenatal, postnatal training, they do not get that confidence in teaching pregnant female. They have a fear in teaching them. So, therefore, we realize that this cannot be mastered in 10 days. Let me ask this question to you, that can you master in 10 days of training the fertility challenges, that hormonal shift, the problems like diastasis recti, gestational diabetes, can that be addressed? What about women on the bed rest cases? What about that emotional vulnerability which they are exposed to? What about baby blues and postpartum depression? At Haloma Yoga, we constantly, through Western science, yoga therapeutic sequences, and with Ayurveda, we constantly keep reminding you with all the 4 modules to help your patient and students that what are the red flags? What should be your next step? And this is purposely meant to integrate, to create a team of therapists who are into integrated healthcare system. So friends, that's why Hello My Yoga specialized prenatal postnatal teacher training course is for 6 months, because prenatal yoga postnatal yoga training is not trend based. It has to be clinically informed. It has to be an integrative education system. So therefore we have a reflection in this program, application in this 6 months. It offers you reflection, time for reflect what you are learning, apply what you are learning. We provide you space for the case discussions, live mentorship, question answers, windows are there, provided to you purposefully so that you can integrate between each module. And how do we plan to train you is through the sandwich model of learning. So as I previously told you that this program has 35 hours of self-study lectures. So we don't offer you self-study lectures in one go. There is a sandwich model which we follow. So there's first set of self-study lectures which will be provided to you. In between, there will be live Zoom sessions to address your doubts. Then again, there will be self-study lectures. Then there will be pauses for applications and reflections. Then again, the teacher will come back with Zoom session to attend your question answers. So there is a constant hand holding throughout 6 months so that you get that stability. Because here the pure purpose is to offer you stability in your learning, and that's what it reflects while you teach those sequences, while you teach your students, your clients, your patients. So instead of attending 7 days TTC and then getting a certificate and forgetting, we are here offering you to build retention, build maturity, and be responsible. So that's why this is a 6 months program. And as I said, that teaching mothers requires stability, and that's what this program primarily offers you. And that's why we have clinical experts. We sat with all the 4 teachers and created content that will help you, not just teaching, just movement, but holding two. You have to understand that you are helping a woman that is holding 2 lives with one nervous system. It's a vulnerable phase. So this requires knowledge, sensitivity, and clarity. And overall, this entire teaching cannot be a speedy program because it requires time, it requires attention, it requires right guidance and integration. So that's how hellomyyoga specialized prenatal postnatal teacher training course is prepared. And before going ahead towards our mentors, I would request and invite by stop sharing and request Bhadraji, who is student of our batch 1, to please speak about how her experience, how her training is going with this prenatal postnatal program. I request hellomyyoga team to please spotlight her. Namaskar, Bhadraji. Thank you so much for joining us.
Namaskar. Namaskar. Thank you so much, Shivani ji, for inviting me to be a part of this orientation program. Good evening, everybody. My name is Bhadra Sinha. I'm based out of Delhi. I'm actually a very keen yoga practitioner, and I believe that I'll be a student for the rest of my life, and that was one of the reasons why I joined this course. And let me tell you, each and every word spoken by Shivani ji is actually so true. This course is extremely comprehensive, and it really provides a lot of stability to the learner to understand a very completely different aspect of yoga, which I have understood. I have always seen yoga as an asana practice, but I think what I have learned from this course is to go beyond the asana practice and to understand the therapeutic part of yoga practice as well. And I think why this course is extremely important, even if you don't want to, I don't want to teach as of now at the moment, but even if you don't want to teach, it's extremely important to understand the phase in a woman's life, the pregnant phase of a woman's life, not just for the purposes of kind of giving her support through the teaching practice, but also for the purposes of giving her support as maybe a friend as well. So if you get this kind of knowledge, which you will through the Hello My Yoga program, you can actually be a great friend of somebody who's an expectant mother, because this course just doesn't talk about the physical aspect of a pregnant woman. It also is thoroughly takes care about her emotional and mental needs as well. Say that our teachers have been brilliant. Apart from the reading material which was shared with us through the online platform, and giving us a lot of room and space and time to go through the reading material, all our mentors have been excellent so far. And we've had some great interactions during the Zoom sessions. It's been a great learning process. A lot of doubts come up when you read the chapters, when you read the theoretical part, and every doubt is taken care of by the mentors and the teachers here. So I really congratulate Hello My Yoga for creating and curating this program, because I think it's a great learning experience. It has been a great learning experience for me. As of right now, I'm on the on the nutrition part of the course, and I'm finding it very exciting as well. So that's about it. That's what I wanted to share with the new participants, and I wish you good luck. And I can assure you that it's going to be a fantastic journey forward. Thank you so much, Ivani ji. Thank you so much. Yeah.
Thank you, Bhadraji, and thank you for giving this feedback, because I always say that the feedbacks are like prana for Hello My Yoga, to keep doing what we are doing. So I have a video to share of one of our student who couldn't be here, but she wanted to send a message. I hope all of you can see.
Namaste, I'm Ashwini Kshirsagar from Pune. I have been doing the prenatal and postnatal TTC from hellomyyoga. Firstly, I would like to thank all the teachers, all the faculty who have been a part of this course and who have curated this course so well. I think that the course gives a very, very comprehensive and a deep understanding of the prenatal and the postnatal phases. I had always been teaching prenatal classes as well, but I have seen a vast difference and a better understanding in myself as a trainer. I'm able to design or curate or understand my clients better and design a program which is not just based on the physical aspects but also covers a lot of other aspects, including your mental wellness, your nutrition, your chantings, your mantras, your spiritual health and growth. So I think overall it has given me a deep insight into what's important and how yoga can actually be used to not only work on the fitness or of the women but also wellness of a woman in all aspects. I firmly believe that yoga has been a hidden gem in our culture, and I think hellomyyoga is doing a great job in the amalgamation of our ancient knowledge and the modern medicine. So I think the applications and the direct use of all of these modules into our teachings, into our understandings have been a blessing for me. So thank you so much for this beautifully designed course and all the knowledgeable teachers that have been a part of this journey. I'm grateful to all of them for being there for us, for resolving our doubts, for just being available to us at all times during these 9 months. And I think I would recommend each one of you who aspires to be a women's wellness coach to pursue this course and explore the depths of yoga beyond the physical asanas. Thank you.
Shivani ji, can I just add one more point? I just forgot to mention it, if it's okay.
Sure, Bhadraji, please.
Yeah. So, in today's world, we hear a lot about we kind of, now we have started focusing a lot on mental health aspect of human life. I would just like to say that after going through this course, what I really realized is that our ancient wisdom, in which yoga and Ayurveda is actually rooted, I think these two practices gave so much of importance to mental health, something which now we are talking about in today's time. So imagine how evolved we were in our ancient times, and that is exactly what you will learn during this course as well, because the biological changes in a woman that takes place during pregnancy, that has a major bearing and impact on her mental health, and then of course on her emotional health, and how to tackle that particular phase of her life, which is an extremely important phase because she's not just looking after herself, but she's equally responsible for another life, who another new life which will be created or which will take a form. So that's what it has been kind of an interesting insight for me as far as this course is concerned, the kind of importance we give, the kind of importance yoga and Ayurveda is actually giving to the mental health aspect of a human life. So that's about it. Yeah.
Thank you, Bhadraji. I believe that with your message, as a student of Batch 1, I believe my job is done. That I'm able to deliver what I want to, what with my teachers, with the entire team on board for this program, we had an intention and we are able to deliver it because you said it so beautifully. You had summarized it so beautifully. So, going back, to my presentation. Now I would like to invite our mentors. So our first module is Physiology and Psychology of Antenatal and Postnatal Women with Yogic and Medical Perspective. So friends, please note down it's physiology and psychology that goes hand in hand. And that's by Dr. Vineeta Ketkar. She is an MBBS practitioner, a family physician with 40 plus years of experience who has been trained under Dr. S.P. Karendikar for 14 years and 10 years under Guruji B.K. Sayenga. She has been integrating medical yoga practices to focus on women's health, which relates to menstrual health, pregnancy and postpartum care, and menopause support. So she has a huge women community, and we therefore took her experience in building the module one. So now I would like to invite Dr. Vineeta Ketkar to please come on the screen. Namaskar, ma'am. Welcome.
Thank you, Shivani. Thank you. And I congratulate hellomyyoga. You are spreading your wings very nicely. Yes. And covering what I should say, the sensitive zones like prenatal or geriatric care, and of course the mind management and various other courses also. So as far as this course is concerned, prenatal and postnatal care, as you know, it's very dear to me because yoga for female health is the what I should say, the flag in our hand, because we are proud of our femininity, and hence we have to be supporting the female life at all, right from 18 years to 81 years. That's what we say. And womanhood is identified as motherhood by the society still. And initially, in previous days, motherhood used to be a very, very natural phenomena. I mean, it was so passively, life used to go ahead, education, then probably job, and then getting married, and then becoming mother, fulfilling the family responsibilities and going ahead. But that is not a smooth journey for today's females. When I interact with them in my clinic, graduation, post-graduation, then probably MBA and other higher educations, pursuing PhD, and probably traveling across the globe and establishing in career, somewhere in between, with God's grace, if you get a good partner, good friend, getting married, and then deciding whether to go for motherhood or not. It's the whole journey is becoming really challenging. So first of all, deciding whether to become mother or not. Of course, today's girls are so determined and they have so much fixed ideas about whether to go or not. So right from that aspects, the life is really very challenging for them. And once they decide to go for motherhood, as just now we heard the testimonials, the peace of mind matters a lot. Physiology works. Physiology works once she becomes pregnant. Because physiology works on precision level. But that precision level has to be maintained and supported by the mind management. So since the pregnancy is very challenging situation for today's female, maybe she is working or she has compromised her career, whatever decision she has taken, whether she has family support or not, taking that decision and going ahead and letting her enjoy that status of 9 months. Every day, every moment, the yoga professional will be part of her life, because gynecologists and obstetricians are playing a part, but that's for a very short duration nowadays. Nowadays, doctors don't have time to listen to patient and respond them in a sensitive way. We are all only looking at the reports and everything is fine. Don't worry, go ahead, next patient, something like that. So the yoga professional has to become a companion, but that companionship definitely demands the scientific knowledge base. And that's how Shivani has given me the opportunity to share the scientific aspects of pregnancy. So how the pregnancy part is going ahead, right from the first UPT test or the first hormone test, human chorionic gonadotrophin test, and then as the pregnancy goes ahead, which are the tests to be done, which are the precautions to be taken, how the diet care should be taken, what are the parameters, what are the indications, what are the contraindications, how you should be careful, but yet to make her cheerful throughout her journey of 9 months. So you are not only attending her, but you are becoming her companion. That is what is important. A very compassionate, loving companion to enjoy her baby as if like it is your baby. So that's what matters. So the emotional aspects, the physiological aspects, and every mother, when she becomes a mother, she doesn't know what changes are going to happen in her life. I mean, it's very difficult to imagine once a woman becomes a mother, you feel only the changes are physical or physiological with the outcome of nice baby. But it's not like that. She fights as if her personality had changed. That's what I have seen with my younger daughter-in-law. My younger daughter-in-law has done MBA from Wharton and she was very much career oriented. And when she became the mother, delivered her first baby daughter. And nowadays after that, she's not thinking about her career, her office and work at all. I mean, sometimes I had to remind her, Priyanka, you are handling a very responsible job. Maybe BCG, maybe Fidelity, wherever it is. But she has totally changed her personality. That kind of motherhood, that kind of dedication, and that kind of change in the personality can occur. It's really very much pleasant and satisfying moment of her life, but the life continues with responsibilities. So the antenatal or prenatal care, being with her companion and bringing her slowly back to her near normalcy life, physiologically, physically also. So postnatal care is equally important because neglecting body at that level or mind at that level is again can prove costly. So antenatal or prenatal as well as postnatal care forms a very important milestone. And Shivani has designed the whole program with additional three supports rather, a very beautiful design. And I wish you all the best. Go ahead and enjoy the course. And we are always there with you. That's it, Shivani.
Yeah, sorry. So thank you so much, ma'am. Yes, indeed, the module 1 is the fundamentals of this program. And from there, we move ahead to the next module of this program, which is the prenatal yoga asana. And that's taken care by Anirudh Gupta, the mentor of module 2. He's a Hatha Yoga expert. He's specialist in restorative and therapeutic yoga. He's the author of the book Prenatal Yoga. And he's deeply influenced by the teachings of Pujya Swami Dayanand Saraswati ji. He integrates his therapeutic principles into his yoga practice and teaching style. Now I would like to welcome Anirudh on the screen. Namaskar, Anirudh.
Yeah, hello everyone. So glad you're seeing this introductory, sorry. Yeah, glad that you're seeing this introductory course for prenatal yoga with hellomyyoga. And what about yoga asanas? So yoga asanas are the spring behind any pregnancy. And uh, what we have designed in our module is how to work that spring. If you tighten the spring too much, you're going to create tension. You're going to create energy, and if the spring uncoils, it's just going to disturb. At the same time, if the spring is not wound deep down enough, it's not going to offer any giving of energy, movement, and things like that. So, in our prenatal yoga course, our course is designed to work just with the right amount of energy for that particular student. Also, yoga is a subject of continuity. many people we see, like they come for prenatal yoga. Okay, we will do 5 sessions, we will do 10 sessions, we will come in the third trimester, we'll come in the second trimester. So, of course, like a doctor, a patient comes to a doctor at any time, a doctor will never refuse. But even for a gynecologist, uh, there should be a bonding between the patient and the doctor. So the earlier the patient comes to the gynecologist, the better the readings can be had, and the doctor can see the patient more than the reports, and then a bond develops. So same way is with the yoga practice, yoga asanas. I don't have to tell, everybody is a very experienced teacher in this forum, maybe better than us, maybe better than me. But what we are trying to do is trying to correct the dose of the yoga asana with regards to prenatal yoga. So, in the first trimester, as we know, like to hold the pregnancy, you need good progesterone, you need very good amounts of HCG hormone. And through our program, we will understand what interacts with what. So a student will say, okay, I'm feeling in the first trimester, I'm feeling too much nauseated. Um, I'm feeling morning sickness at a very great level and things like that. So what kind of yoga asanas work then? So we don't want to go in a strict um, flow chart. We in prenatal yoga, unfortunately, flow charts do not work. What works is inherent intelligence, because every woman has a different psychology, different need, different age, different body, different physiological, physical background. And hence the yoga asana has to constantly be adapted to her needs. Like now in the first trimester, for example, we need to look more upon the um, um, cervix, or how strong the cervix is. We need to know, okay, if the cervix is still very tender, it's not yet closed, or the internal OS, the uterus is not very far away from the internal OS, then what kind of asanas can be done? So, in case the pregnancy is delicate in the first trimester, then we do kind of recovery poses, we suggest breathing, but something or the other ought to be done. Lying down, now many doctors will say, okay, like the pregnancy is difficult, or the female may psychologically see herself not very capable. So we will say, okay, let's lie down. The healthcare provider will say, lie down. But if we are lying down, so we can't lie down 24 by 7. We have to rise up, have breakfast, have tea, and then we are on the bed, assuming this is the bed, and then there's a TV in front of me to pass my time, and I am like this. In my mind, I'm lying down, but I'm constricting my pelvis. I am putting crazy amount of load on my intestines. I am not giving any space to the uterus to expand. So I'm doing the opposite of what I ought to do. So I'm not saying when rest has to be done, do not rest. What I'm saying, in our module, we bring rest intelligently. Also, in the first trimester, like Dr. Ketkar just gave an example, like everybody is hardwired in working before the baby comes, and then suddenly something happens, and then the maternal instincts come, and there is a very drastic shift in the outlook to life. But prior to conception and even during conception, the mind is so wired towards work culture that we forget we have a life growing in. And at the same time, in today's world, except for, I think, medical line and architectural line, most of the jobs have become, based on sitting patterns, and we are sitting quite a lot, driving quite a lot. So invariably, we are compromising with the orientation of the pelvis. So again, in our module, we have shown in the first trimester how to, recorrect the pelvis without bringing any pelvic load. In fact, there is a saying, what is good for the geese is good for the gander. So anyone who's doing prenatal yoga will also get clues as to manage other parts of life. Now, for example, let's talk about acid reflux, because acid reflux uh, is a given during pregnancy in the second and the third trimesters. It is a given for whatever clinical reasons we will discuss. But if my pelvis, say for example, is if I'm not correcting the orientation of my pelvis, I am already creating patterns of reflux. So when through a yoga strap, I'm correcting the pelvis, I am seeing I have a neutral pelvis, I am restricting my anterior pelvic tilt, I am creating length in my tailbone. So when I start to create length in the tailbone in the first trimester, when I am birthing in the end of the third trimester, I restrict elements of coccydynia, where I don't hurt the coccyx during delivery. Or even postpartum, the lower back, tailbone become very, very sensitive. So you will see there is a pattern to what we are going to go to. It's just not random asanas. Our asanas are not taken by Instagram posts, AI driven. We have not gone through 10 books and just picked up asanas and then pieced them together. There's a very big and deep science to it. Also, of course, we suggest that our students read other books on yoga. So compare us, rate us, and you will see that we have actually done a very good job. Now, many people will say there are books, by Geeta ji. She's a very revered teacher, and she's written so many books on women's health. And one of them is, I might not get the name right, Gem for Yoga, Gem for Women, or something like that. Now, in that book, it is written, Supta Padangostasana during pregnancy ought not to be done. Now, of course, that is right, but it was right when the book was printed, because at that time the strap was never used for yoga. So that time Supta Padangostasana was done with hand to toe. So if I'm lying down here, I would be like this. Now this is creating abdominal stress. So hence Supta Padangostasana in that book was suggested ought not to be done during pregnancy. But now the paradigm has changed. We want to lengthen the hamstring, because the hamstring goes and affixes into the lower back in any case. So if you want length in your back, you want length in the visceral space section. So now we start to use a strap, and Supta Padangostasana is recommended in the pregnancy all throughout. So there is a way and a science and the time. So how and where the postures to be done. Also in our module, you will see that we have not shown too much cat cow, like in many other yoga practices and many cultures abroad. Cat cow, cat cow, cat cow. Keep on doing cat and cow. Now, you have to understand pregnancy brings certain things. Like, for example, wealth will bring uh, certain characteristics. It might bring pride, it might bring ego, it might bring jealousy. Education will bring certain things. It will bring qualities of um, looking at the world in a different way. So everything will bring something or the other along with it. This is the world, this is Shrishti. And pregnancy brings along with it too much flexibility. So, in the first, second trimester, in our module, we do not do mechanical asanas. We do not do Bhadakonasana almost immediately. In the first trimester, we do Bhadakonasana so that the blood flow can come into the cervix sufficiency can take place, the placenta can form better, the placenta then can move away from the opening. So all these things, we just do few Bhadakonasana in the first trimester. Then we allow the pregnancy to hold, and then we come to Supta Bhadakonasana a bit later in the pregnancy. So, but what we see randomly, like a cat cow, then we see a lot of butterfly sit and just keep doing this. This is going to weaken the pubocervical ligament, and this is going to increase pains that arise due to round ligament, or it's called round ligament pain. And if the round ligament pain was naturally to come in the 9th month, it starts coming into the 6th month because we are doing this. Because we in the first month only, second trimester, first trimester, we've started doing this 100, 50, 100. We think we are doing something, but this ought not to be done in pregnancy because the relaxin hormone the universe is already giving to work on the breadth of the pelvis, broadening of the pelvis. We need to make sure that the structure of the pelvis is remaining integral, becoming stronger, so it can safely broaden out. It can safely broaden out. So we use intelligent means and ways of posturing. Also, we have shown a lot of inversions, like you will see later on in the pregnancy. A lot of women also experience constipation, and along with constipation, there are also hemorrhoids, for the time being that come in. So inversions bring a little relief from all this. And for the moment, it unloads the pelvis, unloads the colon, allows some intestinal work to be done. And then that evacuation is more safer, smoother, and the student feels psychologically very empowered. At the same time, you will see in pregnancy, the first thing is that they also test is your TSH, T3, T4. So asanas which encourage your thyroid gland are done safely with a chair. And we have shown in our videos, we will also show in our live modules, if there are doubts, how these asanas can be done. And week by week, we have planned the asanas. And also, besides planning the asanas in our modules, which will follow Q&A modules, introduction modules, which will follow educational modules that follow, we also speak about what to do in case there is preeclampsia, what to do when there is gestational diabetes, what to do when there are cervical insufficiency and stuff like that, how to spot doming. When doming is happening, a bulge on the upper abdomen is happening, that means that the lower abdominal organs and muscles are not doing their job very well. So then at those times, we have to stop and come back to recovery poses. Make sure that she's not loading the lower pelvic floor muscle too much. Otherwise, the doming happens on top here. So there's a lot of intelligent sequencing posturing here. And I would invite you to go through it and then have a look at it.
Thank you, Anirudh. And yes, very well put together that it is therapeutic, but it is intelligent sequencing. because during how Anirudh has built the prenatal yoga asana is week by week sequencing, but he has put together the right modification, the right transition, and the right understanding of the body so that you can modify the yoga asana. So, moving ahead to the next module, our next module is Ayurveda for Pregnancy and Postpartum Wellness, and that's by Dr. Sharon Samuel. Dr. Sharon Samuel is an Ayurvedic doctor and head of the Department of Obstetrician and Gynecology, and she's part of leading Ayurvedic medical institutions. She, with more than 15 years of experience, she has been guiding 500 plus women through childbirth and postpartum care using Ayurvedic principles. Her expertise includes fertility and hormonal health, menstrual disorders, menopausal transitions, psychosomatic disorders, preventive and rejuvenative care through lifestyle modifications. So let me invite Dr. Sharon on the screen. Namaskar, Dr. Sharon.
Yeah, hi Shivani. Hello everyone. So this is about Ayurveda, and most importantly, what Ayurveda has to talk about pregnancy care. So that is a very underexplored area. So when we look at information which is available on the internet today, there is a lot of information, but still there is very less authentic information in this particular area. And though Garbhasanskar, this term has gained a lot of popularity in recent times, I still believe that the information available, if not constantly backed and explained and communicated rightly by the right people, you will still not get the right kind of idea, because it took a lot of time for me as a practitioner, a lot of time, and I still am trying to understand every single bit over and over again till I get the right meaning. So there are a lot of discussions and Tadvidya Sambhasha, like we say, we discuss among ourselves a lot with my colleagues, with my juniors, with my students, and with my seniors, to get a better perspective of what is told. Because Ayurveda always gives us ideas in a very summarized form, more like a riddle kind of way sometimes. The intention is that whoever reads this science and preaches about it has extensive idea, knowledge of the science itself, one, and also about what's going on in the current scenario, wherever you belong to. So now we're living in 2026, where technology is advancing at such great speed, and we have it's so much information available. So it's important to connect today's ideas with the ancient ideas, and then combine them and use something called yukti, which is your rationale, to come up with the right kind of advice to suit this generation, which is why Ayurveda is told as a science of every generation, though it was told long ago, because it's very important to connect that information with this information, which is why this speciality of ours uh, is considered one of the pillars of Ayurvedic hospitals itself, because we do a lot of work in empowering women and the generation that comes next, and along with that we bring along the entire society, and I think that's what you are also going to do as prenatal and postnatal yoga teacher as teachers, because when we deal with women, it's very important to guide them the right way, because when you empower them, you're bringing along that next generation and the entire society. So keeping this in mind, I would say that there's a lot of responsibility on you all. One is because, like what I said, when you talk to women, women talk to women. And so you are actually passing it on in a at such speed. So it's very important that you give them the right information. Secondly, also because you're not talking about a scenario which could be, where a mistake can be made. We're talking about a very important, crucial part of their lives where you cannot afford to make mistakes. That is why it becomes very, very important to know what you know in the exact way that is supposed to be known, which is why we're all here. And like Shivani, like everybody says, Shivani's brought along the right kind of resources together so that you have everything available with you to be the right kind of practitioners that today's world needs. So, keeping this in mind, I've drafted this curriculum with, of course, with the help from the Hello My Yoga team and Shivani, of course. And you would have, of course, gone through the curriculum and you know what we're talking about. The intention is one is that Ayurveda has a very holistic understanding, and yoga is very closely connected to Ayurveda. More like sister concerns, we work parallelly. So, and Ayurveda has a holistic idea, that is, we deal with the body, mind, and the soul. And we also take into consideration every single thing that affects body, mind, and soul, which is everyday activities from diet to lifestyle. Everything comes under this. So, understanding these elements are important when you want to understand yoga as well. And when you're applying it to pregnant women, it becomes more and more important to understand. So it's difficult to separate yoga and Ayurveda. So that is why the first part of the curriculum is to refresh your idea of Ayurveda, which you had already learned in your yoga teacher training course. Secondly, the attention is brought towards preconceptional care. That is the importance of preconceptional care, because care starts right from then. It can start after pregnancy as well, but the right kind of care starts when the couple starts preparing for it. And knowing that will enable you to guide your female patients who are looking to conception, so that when you do that, your pregnancy care also becomes even more effective. So you're able to deliver the best for your clients. So this is why preconceptional care takes one major part. Ayurveda places a lot of emphasis on preconceptional care, because that is where you get to do all that you can to make sure that that patient is in her best health when she's entering into pregnancy, because pregnancy is a very delicate phase. Pregnancy, like Ayurveda says, it's like carrying a bowl full of oil filled to the brim. If you're carrying something like that, how would you walk? You would walk with such care that even one drop shouldn't fall off. So that is the kind of care that you need to give a pregnant woman. So it's very difficult to do intense therapies, aggressive treatments on pregnant women, which is of course not indicated. So if you want to do any kind of corrective measures, you have to do it before she plans to get pregnant. In that way, we can at least avoid and or reduce the intensity of conditions like GDM and hypertension, which are very common in India. Even avoid anemia, if she's going to get into any kind of pathology, we can foresee it and prevent it as well. So preconceptional care is very, very important. So given a elaborate explanation on preconceptional care, because the scope of what we can do there is very, very, very high, and we must all explore that area. Secondly, talking about pregnancy care according to Ayurvedic principles. So, of course, you will be learning about the anatomy and physiology of pregnancy, and also how pregnancy labor goes along with Dr. Vineeta. Here, I've tried to give you an idea of what Ayurveda speaks about pregnancy, about how doshas, these ideas that you learn in Ayurveda, how to implement them when it comes to pregnancy, and how to identify issues, and how to correct it with diet and lifestyle, or how to correct it with minimal medication. Of course, medication is not going to be in your jurisdiction at all. You will have to refer to an Ayurvedic doctor, but at least you know that something can be done, and you have a point of contact as well. So you are empowered that way. You have a reference point and you are not at a blind spot there. So this is, and I've also tried to give an idea of the issues that could happen, how to foresee them and how to correct them, and how to take care of diet, because Ayurveda talks about Garbhini Paricharya, which is pregnancy care. But it's again a very short description that they have given, because like I said, it's about understanding the principles and implementing them. So you need to have an overall idea of Ayurveda, which may be difficult for a yoga practitioner. So, because of course the science is vast in itself, it's very difficult to get all of it right. So I'm just trying to give you a glimpse into the concept, so that when you have a doubt, you can always get back and get more information and then revert to your client. So you give them the right kind of information. And how to alter trimester by trimester, pathology according to pathologies, according to the maternal requirements and according to the fetal requirements, according to physical and emotional requirements, how to alter your care, how to take care, and how to prepare them for labor, and how to prepare them for postpartum care. Now, that is the next segment that we are dealing about. So we dealt with pre-pregnancy, pregnancy, and post-pregnancy as well. Post-pregnancy is again like preconception. It plays a very important role because you are enabling the woman to get back to her life. Like Dr. Vineeta said, again, I'm putting her, women are now doing a lot of things. They are always in a hurry. They want to finish things and go to the next part of their lives. And we have to respect that because all of us want that for ourselves. And your clients will also want that. It's going to happen. So, how do you empower them, enable them to get back to their regular lives with yoga and with Ayurveda? So, Ayurveda is a very elaborate Sutika Paricharya post pregnancy care, which works on correcting her health physically, emotionally, and also making sure that the newborn is also taken care of in the process. So this will give like a 360-degree care of that woman. So you're not just leaving her after labor, but you are carrying her with you after that also. If you do it, if you're doing it the right way, you will be able to make a lot of difference in her life. She will never ever forget you. So I think this is a very important segment, and I've covered this also in our curriculum. And again, while understanding all these concepts, the takeaway is that one is that we foresee problems. Like I see, it enables us to foresee issues. Second is when we foresee, we can help prevent it as well. So preventive care is the goal. We may try our best to ensure that she's in her best health. Like Sir Anirudh sir was saying, we make sure that everything is at its best place before she gets into pregnancy. And even if she is into pregnancy, we correct it at the earliest. If it's position, if it's going to be the position of, if we look into the problem and we correct it at the earliest so that it doesn't amplify. And then it reaches a point where correction becomes difficult. So we foresee these issues and we prevent them, which is 100% possible with Ayurvedic measures. So knowing Ayurveda makes your yogic practice stronger. It makes it enhanced and much more. You can have better authority when you do your practice because you are fully informed of the do's and the don'ts and where you are, where your strengths are, where your weaknesses are. It's important to know your weaknesses as well so that you don't overstep things and you know where to refer them and when to refer them, which is very important when it comes to obstetrics. Lastly, you all know, I'm sure most of the yoga practitioners are already Ayurveda. They have an idea of Ayurveda, and some of you are already subconsciously and consciously practicing Ayurveda. So the philosophical connection, the cultural connection between Ayurveda and yoga is so thick that it's difficult to separate them. And entering into yogic practice definitely will include Ayurveda. When you enter into yogic practice for pregnancy care, there are a lot beyond just what you eat and what you do and what you consume in the form of medications. There is a spiritual aspect also to it, which Ayurveda also brings into picture because even now, despite all these advancements that we have made, pregnancy still remains a matter of mystery. And pregnancy, the entire, though we've gone to the level of IVF where we are taking the cells and, putting them together and maybe creating a pregnancy, 1 in 3 chances of creating a pregnancy. Still, how it happens, how one cell becomes a multicellular being is still a matter of mystery and curiosity for all of us, even the greatest scientists. So long as that's there, we are always going to bring the spiritual element into it. And bringing that element, understanding that Ayurveda backs it, only helps your practice stronger, you can confidently tell them what you're doing. We can combine Ayurveda and yoga and make sure that your clients are getting the best of both worlds. So, this is what we have tried with this curriculum. We have tried to bring in all the aspects, information which is available in Ayurveda about preconceptional care, pregnancy, and postpartum care. And I've tried to put it in the simplest ways possible. So what you hear may be simple, but I'm always there to explain more about it in our live sessions. We've also touched on infant care, sleeping patterns, and weaning patterns, because that's where most women get confused. Why a yoga practitioner should know about it is because you become her best friend somewhere during the line, because this is her most vulnerable period. And if she gets you to speak to at least twice or thrice a week, she's definitely going to be opening up to you at some point. And and if you are not equipped with the right kind of info, then she might find it out at some point, because that's not how it's supposed to be. End of the day, you're going to be one of her healers. You're going to be one of that support system for her. And so we have tried to make sure at that point also, you know what you're speaking about and you have right information. And once again, you know to identify where you don't have information. So this is what we've tried to do in our curriculum. And I really hope that you go through it and do ask us questions. Keep notes and ask us questions, because we cannot cover everything, because it's very, very vast as such. But I'm really looking forward to answering your questions over the course of the program. Thank you, Shivani, for organizing, for arranging this. Yeah, and thank you everybody for joining today.
Thank you, Dr. Sharon. And I'm so sorry, I quickly shared the screen, but you were there on the screen as well. So thank you so much, Dr. Sharon. And I would like to tell to all the people who are attending this program and later watching this program that hellomyyoga's program do say it's prenatal and postnatal, but with the help of Dr. Sharon Samuel, the Ayurvedic knowledge, and with the help of Dr. Vineeta Ketkar, the Western science, we have also covered a great lot of things, lot of authentic information on fertility as well. Because that was an important part of it to understand the onset of pregnancy, what is the preparation required. So that's why we have covered fertility part as well. And as Dr. Sharon said it well, that this is a holistic training, and this holistic training has come into picture with the help of the right mentors who are clinical experts, and they have given right training. And this right training intends to offer you confidence. So without confidence, as you become the support system of these females, therefore the confidence is the most important thing, and confidence comes with the right knowledge. So friends, moving ahead to the next module, before introducing the next module, I would also like to tell you that this entire phase from prenatal to postnatal is actually from womanhood to motherhood to womanhood. And this is a very strong phase of transition in a span of 9 months. So here we realize that one thing is very important, which is pranayam and meditation, that helps them to understand this transition, to help them to smoothly transit through these transitions. And therefore, this module has been kept separately under the guidance of Samanta Duggal. Samanta Duggal is senior yoga teacher with decade of global experience in Hatha Yoga, Yin Yoga, Restorative Yoga, Yoga Therapy. And she's a certified in Yoga Therapy and Children's Yoga. She's an expert in advanced pranayam, meditation, and yogic techniques. So now I request Samanta Duggal to please come on the screen.
Hello, everybody.
Namaskar, Samanta.
Namaste, and thank you, Shivani, for having me on this teacher training. It's an absolute honor, because I can see the amount of experience and background that all the mentors bring to this program. I've had the privilege of, yes, doing a lot of traditional Hatha Yoga practices, but also having the privilege of learning a lot of the psychology behind people and the way they learn and the way they act and the way they behave and the way they think, and emotional and mental aspects, which go very much along with the physical aspects of the practice. For me, movement and breath move together. So first, I'd like to start by saying that your asana and your pranayam and your mantra and your meditation cannot be separated. As pre and postnatal coaches, this whole thing, this whole flow of your support moves with all of these aspects together. So they just cannot be separated. One supports the other. Yeah. The whole module is based, of course, on Ahar, Vihar, Vichar, Vyavahar, the ancient traditional practices. But the Vichar part of it sometimes is kind of left out. You know, the practices which are kind of more passive and they are maybe only breath centric or maybe only mantra centric. We sometimes focus a lot on just the asana aspect of it. And in this module, we want to try to promote some of these practices because, as we've heard from all the mentors, that this is such a complex journey for the woman, especially in today's age, where women have many more responsibilities. Well, there's motherhood, there are wives, some of them are working, and there are a lot of complexities. Besides, she's also dealing with so many changes. She first conceived, so that whole journey of conception, of finding out, and then that first trimester where she's experiencing nausea, and there are all these hormonal changes happening in the body. Then she moves to the second trimester. There are all these physical changes which are happening in the body. She kind of loses touch with her own self, with her own mind, her own emotions. And then through the third trimester as well, and then labor, and then, postnatal care. Each part and segment of the journey brings about a different state of mind. Just like how the physical body is changing, her mind, her emotions, her belief system is also changing. So what we've tried to devise in this particular module is what are the practices which will support that. Yeah, so as a pre-postnatal coach or a therapist or a teacher or healer, whatever you would like to call yourselves, we really do bridge the gap between doctors, physicians, gynecologists, even the family, the husband, and you become the best friend. Yeah, you're there throughout. So basically, the module designs around. We've kind of divided it into 4 aspects. The first one being pranayam, and we've gone quite a bit into the actual experiential practice of breath and breathing, and a little bit of background between each of the breathing techniques. Here, I really would encourage you all to actually practice these techniques yourself before you actually teach them to your to the one you're caring for. Yeah. And because this will really help you discern what she actually needs in that hour. Though it's very specifically said that this is what needs to be done in the first trimester and these are the contraindications, right? We've also covered some aspects of mantra and fetal talk, the whole practice of Garbha Samvad, what mantras can be chanted, what mantras can be listened to. There many, I mean, I've had the privilege of studying Vedic chanting. If those of you who know Vedic mantras, we've covered some things and some tools and techniques which can be used. There's also the beautiful technique of actually talking to your fetus, talking to yourself to change the way you feel, and because of all the changing emotions and the hormones. The third segment is more about meditation and just introducing different meditative techniques There are also times when a woman cannot actually do a physical practice. Yeah, you may have to just rely on just breath or mantra or meditation, or maybe she just wants to listen to music and breathe. So here, these techniques really go beautifully together. There's also a particular meditation which is very close to me, where it's a couple meditation. So it's not just done alone. Or it's a chakra meditation where you're visual. So it's different techniques, both for the audio, for the visual, for the kinesthetic person. Yeah, and the last segment is mostly based on relaxation techniques, which is so important. Just as Anirudh said that, just by lying down, not moving, not doing anything, yeah, you can still lie down and still visualize and still affirm and still experience a beautiful sound healing, or still move energy in your body by just relaxing and changing your mental and physical state. Yeah, so many of these techniques also require you to study a bit deeper, especially practices like the self acupressure things. You need to be very technically informed about these. We've tried to cover these things in this module. Also, where sound healing is concerned or where mantras are concerned, you may need to learn those mantras yourself. And of course, I'm there to support you where you need that little technical support, where you can go and train yourself further, maybe for sound healing and things like that. A lot of the practices are also very intuitively based, because when you go to teach someone and you have a certain practice in mind and you see her state, her emotional or mental state, she may not be up for a practice like that. And then you may want to use one of these beautiful techniques that we have introduced in this module. I also link some of these practices to modern day practice, there is a huge movement towards what is called psychoneuroimmunology. I've touched upon that briefly. It is basically how your belief system, your conditioned beliefs and thoughts and your samskars, which actually influence your body and your immune system, which is very, very helpful to reduce anxiety, inflammation, and cortisol level in the body, especially during labor, and also supporting you through difficult periods like postpartum depression, or times when there is a complication in the pregnancy and you cannot move so much. So again, it's actually a melding of Eastern and Western techniques all together. So yeah, that's just about it. And I hope you really enjoy this module. I'm here to support you through this journey and answer any more questions that you may have through this space. Thank you so much.
Thank you, Dr. Sharon. Sorry, thank you, Sharon. Thank you, Samantha. So sorry. Thank you, Samantha, for this. And friends, very beautifully said by Samantha that the gems of the teachers have come together to teach you something really which holds relevant today and offers you confidence while you teach. And that's why this program is spread through 6 months, being a 60 hours program, online program, but spread through 6 months to offer you the right training, the right knowledge that helps you to teach in confidence to your patients, to your students, and not only become their support system, but also help them giving those practices that eventually become their support system. So friends, before we end this entire meeting, this gathering, so the fee structure you already knows about it, but still I would like to mention it here again that the Indian participants enrollment begins with 59,999, while international participants it's $999. We do have installment options. There are no extra charges added to the installments. We have early bird offers also, and we have many other benefits and privileges for the students who are paying themselves for this program and they want further breakdowns on the installments. So if you are interested in this program and you really want to make up for this program, and however, there are situations, we are there to help you out. Because at the end of the day, we want to make a team of yoga therapists who further helps the community, who further helps in creating an integrated solution, integrated therapies where the Western science, Ayurveda, yoga therapy, pranayam, everything comes together. So now we are open for the question answer session. If there are any questions, please unmute yourself. And also the students will be later watching this videos. So if you have any questions, you can also reach out to info@hellomyyoga.com. However, to all the students, they'll be receiving an emailer post this program on their registered email address with the program brochure. Whatever information I have presented and the teachers have presented, everything will be provided to you in your inbox. So make sure info@hellomyyoga.com is not in your spam, but in your primary inbox. So we are open for the question answers. If there are any questions, please unmute yourself and ask.
Please ask something that will be fun. Just ask anything under the sun. You have your mobile GPT, some tough questions. Chat GPT, something tough, and ask us.
So that's okay. You can still watch the videos later on. And if you feel again that there are questions that need to be answered, or there are any doubts that need to be answered, we would not mind to take it to the teachers and ask them in specific and get you the answers before you enroll, because there should not be any kind of doubt before you join this program, because this is a training that requires not only a lot of hard work, but you need to be compassionate as well, and you need to trust this.
So I would like to add, during my prenatal teaching, in fact, yesterday I was invited for a day trip to Jaipur by one family. So I caught a afternoon flight from Mumbai, had lunch with that family, and came back in the late evening. So this is, as a prenatal teacher, what kind of bondings you are exposed to, what kind of wonderful life. And as Dr. Sharon and Samantha said, like every pregnancy is different. Every pregnancy, you have to think out of the box. You have to see how you're helping that woman to the best ability, but not, of course, overstretch it. But at the same time, see that she's getting something out of it. So this module with such revered and extensive people, teachers like Dr. Sharon, Samantha, Vineeta, I think it's. I would love to be a teacher, a student on this portal. Yeah.
Thank you, Anirudh, with such a sweet feedback before closing this program.
Yeah.
Do
So,
we-
have I any questions? I hope. Please ask. Jasmine, are you audible? Can you ask us something? I just know her, so I hope she's the one who I know.
Hi, Anirudh.
Yeah, so come on, now that hi, just ask something under the sun, moon.
So actually the reason that I was very keen to sign up for this program is because my sister is expecting a child, and of course it's probably too late for me to finish this program and help her out now, but I figured that there will be many other such people who would still need help, and I hope that the next time I would be more prepared to help family and friends who would be expecting a child.
Absolutely.
But so that said, my question is that since this is a self-paced program, self-learning paced program, and it's over 6 months, is there a way that we can finish it sooner, or are I'm not sure as to
Yeah, so
first
basically, very, very
practice
good
sooner if I
question.
just put in more time per day on it.
Yeah, so in our first module, what we have seen is that the students, yeah, I think this module is 6 months. Our first module was 9 months. Am I right? Yeah, even in the
Yeah, so
first module
first
of
batch
nine
was
months,
Okay.
first batch of 9 months, the sign-ups, the people who signed, the teachers who signed up here, in 2 to 3 months also they were not finishing their, their target courses. And so many times our Q&A, our explanations just went a little
They were
longer
a lot more
because
in depth
they were
than
not able to pace up.
okay.
But I think you can send an email to Hello My Yoga, and maybe just for you, Shivani can do something.
All right. No, so from what I understand is that I should expect it to be a whole lot more in depth than one would assume.
Yeah, because see,
Might
like
not be as
we
easy
are
to
doing,
actually
if we are
finish it.
doing, say, a 20-day TTC, 30-day TTC, and even Samantha will agree with me. Like, we go to workshops, retreats. How much can we bring back?
Of course.
So, of course, workshops are very good, excellent fun. I go myself, but when I come back from a workshop, I actually have to struggle. What did I do? What? And this is prenatal TTC. You're not only with one teacher, you are with multiple teachers here, and then you got to correlate the dots, like what's going to happen. Somebody's going to ask you what kind of diet I'm going to take. My HbA1c is going up, I'm moving towards GDM. Then you have to explain to them, hey, GDM is actually not in pregnancy. Diabetes is not a pancreatic problem. It's this placenta problem. And then what kind of foods go. So, like what in pregnancy, like for pregnancy TTC, what is good for the geese is good for the gander. But within pregnancy, what is good in diabetes is not good in prenatal. They're totally separate elements.
Absolutely.
So, like when a lady girl is having preeclampsia, she's having hypertension, age is high, then low dose ecosprin aspirin is given, which is given in heart conditions as well. But the manifestation needs are totally different. So you will see, when you go through the program, you will actually want to wish that it is a little slowed down. But we are happy. Hello My Yoga is getting your fees. We are happy to do it in a month.
No, that's not what I meant. I was just hoping that I would be able to help my sister out sooner than later.
Where is she based, your sister?
She's based out of Bombay only, but
Okay,
she didn't have a planned pregnancy, which is why,
okay.
like, I mean,
That is even better. Unplanned things are so spontaneous, so much joy in life.
yeah,
Yeah. You reach out to me.
absolutely.
Samantha's from Mumbai. I'm from
Because
Mumbai.
I, of course, am not prepared to help her out, and that's why I thought I should
Okay.
sign up for this. But um, yeah, I will.
Yeah. But congratulations to
Thank
you
you.
becoming a
And
niece or a nephew. Yeah, niece. Yeah. What aunt, sorry.
yeah,
Yeah. Anyone else, please?
Anirudh can I just come in here as a student, just to give a
Are,
response to her
please.
question? Um, yes, it is a 6 months course, but let me just tell you out, I am just purely speaking out of experience. Please don't be in a hurry to finish it because there is so much to learn. Even if you've been a yoga practitioner, you will actually get to learn so many new things. And it's very important that you grasp them properly before you help somebody with the practice, and especially, a woman who's expecting.
fair enough.
So I understand that there is a genuine reason for you, why you want to pace it up. But purely out of experience, I'm saying I think you should try to be as slow as possible. And as Anirudhji said, even I would have preferred it to be at a much slower pace, because there is really a lot to learn. There is actually a lot to learn. Yeah. I mean, it's been such a self-learning experience for me, despite the fact that I'm a mother of two girls. I have learned so much after being a part of this course.
Fair enough. Thank you so much for sharing your experience.
Thank you, Bhadra. And do we have any more questions? So we do not have. So thank you so much, everyone, for joining us. And thank you so much, Bhadra, for helping us to summarize this program so well. Without your experience, we couldn't have conveyed the right message. And thank you so much, teachers.
Thank you
For joining us today.
Thank you so much.
Thank you.